preparing and releasing a statement at around 3 o'clock with information about what's happened from Thursday to Friday. Dr. Bonnie Henry will be briefing here at noon. After that, we'll be back to Monday at 1:30. And with that, I'd like to introduce Dr. Henry. God bless.
Thank you very much. And I will start by acknowledging that we are on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're very grateful for the keepers of this land. For our COVID-19 case update today, we have 34 new test positive cases here in British Columbia, bringing our total to 1,370. That includes 626 people in Vancouver Coastal Health, 508 in Fraser Health Authority, 82 on Vancouver Island Health Authority, 130 in Interior Health, and 24 in the Northern Health Authority. Right now, in terms of our case status, we have 132 people who are in hospital around the province, and of those, 68 are in critical care or ICU. We have, unfortunately, 2 more people who have succumbed to COVID-19, bringing the total number of people who have died to 50 in British Columbia, and that is 1 person in Vancouver Coastal and 1 in Fraser Health in the past 24 hours. 858 people have fully recovered from COVID-19. I do want to talk for a few minutes about long-term care. We have no new facility outbreaks, and indeed we have an additional long-term care facility where the outbreak has been declared over. That's really good news. The 20 remaining facilities, however, continue to have active cases, and we have 235 in total cases that are associated with long-term care and assisted living, including 143 residents and 92 staff. And as you know, the vast majority of the people who have died are seniors and residents of long-term care. We recognize that residents of long-term care really and assisted living are very vulnerable to COVID-19, and the most important area that we do and what we are trying to do is make sure that the workers who provide the care and the service to people in long-term care are able to work at a single facility. This is something that we have recognized in public health from the very beginning of this outbreak, and indeed recognized it from outbreaks that we have every year, whether it's influenza or gastrointestinal outbreaks or even antimicrobial resistance outbreaks. The challenge that we have with care providers needing, and healthcare workers of all kinds needing to work at multiple different facilities makes it such a challenge to try and control outbreaks, and that has been brought to the forefront during this pandemic in many ways, and it is a part of the tragedy that we're dealing with the multiple long-term care facility outbreaks. And we have mentioned before, but as of today it's official, we have been using orders under both the Public Health Act that I've given and under the Emergency Programs Act to implement a process to make it possible for care workers, healthcare workers of all kinds to work at a single site only, and to be able to do that in a way that's effective and able to give support to staff who are continuously continuing to respond courageously to the monumental challenges that we're facing, and to do their very best and the very best we can do to protect our elders and seniors in long-term care and assisted living. And they have our tremendous respect and support during this pandemic. This is, as we have said all along, we are taking a cross-government, all province, and every single one of us in this province are responding to try and stop COVID-19 from affecting our communities and our families. And this involves ensuring our healthcare system is robust and ready, and we've done many things around that. This is another step in long-term care that we know will make a difference. Taking care of our frontline healthcare workers so they can care for us is another important piece. protecting and providing support to our most vulnerable, whether it's people with disabilities, people who are living on the streets, people who are in long-term care, our older citizens, our seniors and elders, people in remote communities and in other facilities. Doing all we can as individuals across this province to keep our firewall strong. And I do want to recognize that so many people across BC are doing their part, and it is making a difference. The single site order that we just talked about makes our health system stronger and is, in my mind, vital to preventing further transmission and protecting our elders and seniors. I also want to recognize the early childhood educators, the K-12 teachers, and the educational assistants who have really stepped up around the province and are in classrooms and daycares to support our healthcare workers and other essential workers, but particularly to support our healthcare workers and our most vulnerable children, the children who are most at risk of falling behind because of this pandemic. So thank you to them. Those kids would otherwise face setbacks that they may have difficult challenges for the rest of their lives, and the work that you're doing is incredibly important. So thank you for that. As I've been saying all week, we are not over the hump yet, and we are going to have a bumpy ride for a while. We're holding our own, and we're keeping it down, but we all need to continue to do this. And when we're going into this long weekend, it's more important than ever that we keep going, that everything we are doing now, we keep up. And I know this is a challenging time for many of us, both physically, emotionally, mentally, and it's hard, especially when those connections that we so need, those meaningful connections, are mostly virtual connections. And that is something that many of us have a hard time getting used to. There are many resources that we're making available more and more to you, and as announced today by Minister Judy Darcy, more is on the way. If you are struggling and you need extra help, please reach out. We talked earlier this week about there's a number of websites. You can reach out to your primary care physicians. You can go to Anxiety Canada, Bounce Back BC, and there is more resources that were announced just this morning by Minister Darcy. So this is a long weekend for many. It's a weekend as well when there's many religious and faith-based things going on. And what I really want to say is, let's make this a weekend to unwind, but to be kind. It's a weekend for us to stay at home and to appreciate what we have. Now is not the time for travel unless it's absolutely necessary and you need to take care of your family. There's lots that we can do close to home, with our family, with the people we live with our close circle of friends. Have fun, but be safe. Reach out to your elderly neighbor, offer to tidy their garden, drop off food, host your own cooking show online, stream a movie with a friend. There are so many things that we are starting to do now to stay connected. We can have a virtual block party at 7 o'clock. I know in my neighborhood, we do that. Sit in the sun and read a book. It's supposed to be nice this weekend, but stay close. It's also okay to go for a bike ride or go for a walk in the sun, but keep your distance. Let's wave hello to our friends and neighbors, wave hello to those that we pass, but from a safe distance. We all need kindness and we all need connection. So let's do that safely and do that at home this weekend, and to continue the mantra to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I wanted to, first of all, as well, acknowledge the territory of the Sanghees and the Esquimalt First Nation of the Lekwungen-speaking people, and to say that this is, as every day when we announce, and Dr. Henry announces an increase in the number of people who have passed away from COVID-19, that number is now 50 in British Columbia, 2 cases today. We wanted to pass on, and I wanted to pass on my condolences as well to the families and the friends of the people involved. This is a very difficult time to express grief. In some ways, the limitations on our ability to come together is most painfully felt by those who are feeling grief, and must be especially painful for all those who have lost loved ones to COVID-19. So I wanted to express just my deep sympathy and condolences with all of those people. There are 1,370 cases, as Dr. Henry said, positive cases, positive tests of COVID-19 in BC. That's up 34. 858 have recovered, which is a tribute, I think, to the fact that people can get well, that they need to do what they need to do and get well and recover from COVID-19. I think, as I've continued to say, there's now 132 people in hospital. That's 62 in Fraser Health. That's 10 in Interior Health, 12 in Vancouver Island Health, 5 in Northern Health, and 43 in Vancouver Coastal Health. And just to note in that context, so 132, which is a reduction in overall hospitalizations. There's an increase in those who are being treated in ICU. There's 4,493 empty beds in the system. And that means our occupancy rate is 58.7% today, and it's even lower, it's below 50% again in critical care units. So that is a significant and ongoing issue. Yesterday we had 3,181 visits to emergency rooms. That's down from March 9th, which would be a typical day of 6,559. And we had 300 fewer ambulance call-outs yesterday than a typical day in BC, and what we're seeing is a somewhat of a reduction in influenza-related calls because of a decline in influenza, although not COVID-19. I want to talk a little bit about some of the implications of the order with respect to long-term care. As you know, as Dr. Henry has said today, there are a lot of cases in long-term care. It represents a significant portion of the number of cases, and of course a majority of 30 of the 50 deaths in BC from COVID-19 have happened in long-term care. I think residents, long-term care and assisted living homes are obviously very vulnerable, and it is a huge preoccupation of all of the work of public health on this issue. And one of the most important things we can do is to protect them and those caring for them, is to make it possible for workers to provide services at a single location. In response to the Public Health Officer's order, and with the support of the Emergency Programs Act, we've developed a single-site transition framework with employers and unions that involves all workers at health authority, nonprofit, and private facilities. And it ensures that all of them receive an equitable wage and scheduling stability so they can work at a single site without financial hardship or patient service disruption. In addition, employee preferences will be accommodated wherever possible in this process. Over the coming days, the Ministry of Health will be working collaboratively and inclusively with the health authorities, HEABC, unions, the BC care providers, denominational health, and private employers. This will include a provincial reference group that will be established by the Ministry of Health to provide recommendations and guidance on systemic issues that are identified. Implementation, of course, will be done at a regional level and is well advanced here in Island Health and Vancouver Coastal Health, and working ahead in Fraser Health within the existing blended service delivery model of health authority owned and operated, affiliates, and private providers. Let me be clear, this does not alter the existing framework of how long-term care and assisted living services are provided. With respect to the financial implications of making this change, government is working on understanding the costs associated with the provincial health officer's direction, but we anticipate that it will be in the neighborhood of $10 million a month. Long-term care and assisted living staff are responding courageously. I think Dr. Henry has said this, courageously to the monumental challenges during this unprecedented time. They deserve our respect, our celebration, and our support. I want to acknowledge all involved, the HEU, the BCNU, the BCGU, the BC care providers, and many more, all of whom have advocated and have supported this change and have worked collaboratively in this direction. This involves thousands of workers, but those workers deserve everything and all our support to do the work that they need to do to ensure that residents are cared for in long-term care and assisted living, and that they're cared for in as much safety as possible. I want to speak briefly about personal protective equipment. We're getting PPE from a variety of new vendors and suppliers, in particular in China. Importantly, we're taking our time to inspect and test any and all PPE that comes into BC before it gets near the healthcare system. This is a normal and expected process. So I want to give you some of the recent examples, success of sourcing PPE. This is from the last week. We've received many donations, 100,000 surgical masks, 83,000 N95 masks, 10,000 goggles, 20,000 gloves, 1,760 protective coveralls. We've purchased 800,000 surgical masks, in addition to the ones we've spoken of before, 157,000 isolation gowns, 85,000 pairs of gloves, and 54,000 N95 masks. And from the federal government, we've received 900,000 surgical masks and 36,000 N95 masks. So we are making incremental progress, but what we need to do and what we are trying to do is buy in the hundreds of thousands. Sometimes it's been suggested that you can buy masks online or people can access them online. Those masks almost certainly do not meet the standards required. And we have to assess and ensure that all PPE is provided to employees. It provides appropriate protections for those employees. That is critical for us, that employees can have confidence in the equipment they're being provided, and we have seen in other jurisdictions what can happen when that's not the case. I wanted to say finally that we're optimistic about the new rules that are going to take place at the border starting tomorrow, and that this is an important period. This weekend's an important time. As we've said, and as Dr. Henry said, this is not the time for non-essential travel. Today I released a joint letter with Tyler Shandro, the Alberta Minister of Health, where we said let's not visit each other's provinces this weekend. Albertans going to second homes or cottages in BC doesn't make sense right now and shouldn't happen. British Columbians visiting Alberta equally should not happen. This is not the time for that. This is the time to be and as virtually as possible, but to be with the ones in our own homes that we care for, that we live with, that we're around. It's a time for that. It's a time to recognize religious holidays, if that's what you do. It's time to celebrate spring, if that's not what you do. If you're not following the many religious holidays that are occurring in these periods of weeks. But it's absolutely the time now to dig in, to be 100% all in, to do everything we can to bend the curve without breaking the rules. And that's what we need to do now. And I think this is an important weekend for all of us. And whether you want to go to Seychelles for a trip, this is not the time. If you want to go to a fishing cabin, this is not the time. This is the time to be 100% all in for one another, for the ones that we love and for the ones that we don't know. Je voulais dire quelques mots en français. Nous annonçons 34 nouveaux cas pour un total de 1370 cas en Colombie-Britannique. Chaque régie de santé compte des patients, bien entendu. 627 se trouvent à Vancouver Coastal, 508 à Fraser, 82 sur l'île de Vancouver, 130 dans l'intérieur et 24 au nord. Nous sommes très attristés de signaler 2 autres décès liés au COVID-19, un dans la région de santé de Vancouver Coastal et un autre dans la région de santé de Fraser, pour un total de 50 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Il n'y a eu aucune nouvelle épidémie dans un établissement de soins de longue durée au cours de la dernière journée, et l'épidémie à Villa-Cathay est terminée. Longue durée et d'aide à la vie autonome restants qui sont touchés et ont combiné 235 cas de COVID-19. Thank you very much. We're happy to take your questions.
Okay, as we move into questions, please press *1 to enter the queue. You are limited to 1 question, and I would ask that you please unmute your phones. You will not be audible until we call your name. First question is from Marcella Bernardo, News 1130. Go ahead, please.
Just regarding the situation now in trying to, I guess, bring the curve, like you said, bend the curve and not the rules, how confident are you that the message has gotten through to people that they need to stay home this weekend if they want no more restrictions to be imposed next week or in the coming days?
Yeah, you know, I think the story is told in what we're seeing in terms of people who are, the numbers of cases, the numbers of people in hospital. It tells me that people are doing what we've asked them to do. And no more time is it important to do that than this weekend. We can watch what's happening around us, and I think that's a really important thing. We are, as I've said, we seem to be holding our own, and I believe that's because people in British Columbia are doing what we ask them to do. We also have some data that's come from a couple of big data sources that show that we can measure that, and that people aren't going out and about, as I say, as much as they were prior to our recommendations. And we just need people to hold this line. You do need to hold this line because we need to keep our communities safe and our families safe here in BC.
Next question is from Tanya Fletcher, CBC.
Hi there. I'm wondering if, on that note, looking at regions outside the Lower Mainland that are reporting 0 or single-digit cases now daily, would there ever be a day the province would consider perhaps relaxing or tailoring rules, perhaps depending on what's happening locally by jurisdiction that way?
Absolutely. We're looking at all kinds of options of things. And as you say, the outbreak and the pandemic is different across the country and across the province. We're a very large province with quite different demographics and different geographic issues. So yes, in many places where there's single introductions, for example, although I will say that right now we have community transmission in most areas of the province. So it's a bit challenging. And we also know that people have come back from traveling to many areas of the province. So we need to measure that as well. But we are looking at what can we do to try and relax some of the issues or to increase some of the, for example, the healthcare needs and address those in a safe way in different parts of the province. And we will be tailoring it as best we can to what's happening in the different areas that we know of. And part of that we'll talk about later next week when we look at some of the modeling, but that thinking is going on now for sure.
Jeff Andreas, Radio NL.
I just had a question in regards to staffing at long-term care homes. You have talked repeatedly about the need to have one person working only at one home, and from your comments earlier, it sounds like that still isn't 100% happening. Why is it taking so long to get that in order? I understand logistics are probably complicated, but it seems pretty important for these individuals who are dealing with our most vulnerable.
Yeah, it is exactly that. It's complicated. There are many different agreements. There's private and public organizations, and it was really a matter of understanding where the problem was, or the problem where people were, how many were working at different areas, and not only is it particularly in the Lower Mainland, the volume of long-term care homes and people who are working at them, but they also work sometimes in home care or as paramedics or in acute care. So being able to pull all that data together was one of the first steps that we did, and that happened over the last couple of weeks. And to understand people's preferences was another part of it. So yes, there's a lot of negotiation. What we didn't want is for things to happen so that people only went to one or two places, and there were people who were left without staff, or care homes that were left without staff, and that is the really important thing. So we have focused it, focusing on the areas, the long-term care homes where there are outbreaks already, and have stopped the movement of staff from those facilities, and it's going broader now, and I don't know if you want to talk to that as well.
Just say that this involves directly, right now we think, Jeff, 4,200 workers who will effectively have where they're working change in this period. We had to consult with 20,000 workers, and some health authorities, this has happened more quickly than others, but it is, of course, an exceptional change. And I wanted to express my appreciation to all those involved, including those who are care providers, who own care homes where there are public long-term care beds, but this involves everybody. It involves care homes that don't have any public beds, for-profit and non-profit care homes with public beds, and health authority owned and operated beds. So it involves a very significant workforce and a huge challenge in that workforce, effectively consulting with 20,000 people, identifying people affected, and then making the change and putting first in all of this the residents. Because if everyone were to decide who are working in two care homes were to decide to work in one, or were to move over to work in one, that would obviously negatively affect care. So at the heart of this is protecting the residents, as well protecting the workers who are doing extraordinary work. We cheer for them every day, and we should. We should celebrate them every day during at times of pandemic, and every other day as well. They do extraordinary things. So there is a lot involved. I think in the workers in question, probably 50 to 60 different collective agreements, for example. So there's a lot of complexity, but what we've seen is real determination on the part of everyone, from the HEU and the BCGEU and the BCNU on the one hand, to all of the care providers on the other, and the health authorities and everyone involved. So it's been a complicated thing, a lot of moving pieces, but I think we're doing the right thing for workers and the right thing for residents.
Next question is from Shrishti Gangda, CKNW.
Hi, Dr. Henry. Thank you so much for taking my question. I just have a question about work sites and mining sites and things like that. You've obviously said a number of times, don't go to small towns, don't go to remote communities. They might not have the resources to deal with an outbreak on their own. I've been contacted by someone who lives in Princeton, which ostensibly has no confirmed cases of COVID-19. He's concerned that the Copper Mountain Mine is bringing in about 150 workers next week for mill maintenance. And he's concerned that, an influx of people from all over BC and Alberta will potentially bring COVID-19 into the community. So for, work sites that are adjacent or in small communities, are there increased precautions that you've been telling those companies to take?
Absolutely, and this is something that we've been dealing with for a number of weeks. We do have guidelines that have gone out, but also working with the health authorities in the regions. So you can't, as I've said several times, you can't let a mine abandon it, for example. So we do need to have workers in there for safety. There is some things that need to happen on an ongoing basis, but how they do that and how people are housed and how people are, their work that they do is spaced appropriately, that we have the appropriate precautions in place, that people are being monitored, that there's a connection with health services in the facilities. All of that has been directed from my office to make sure that we're doing what we can to make sure that if anybody is identified with COVID, that they're able to be cared for either on site, or that we have a plan for how that will be managed. So yes, there are some very detailed plans for all of the industrial sites around the province that this is affecting.
Penny Dafflo, CTV.
Oh, hi there. Thanks very much for taking my question. Now that Dr. Tam has presented modeling and been really transparent about what they're looking at for infections and a death toll nationally, will you give us the numbers that you've been working with for BC?
We've already given you the numbers we're working with BC. Our modeling has been slightly different in that I don't feel there's value in some types of the projections that have been presented. Our modeling is about what do we need to prepare for, and as you can see, the deaths are not something that can be predicted. It depends on how your outbreak evolves, and so we'll be continuing to use the modeling. We use some much that is very similar to what they have in what they presented this morning, and as a matter of fact, we've contributed to much of the modeling and the data that they're using. So we will continue to present, and we publish the ongoing epidemiologic curve and the case counts and our test positive rates every day on the BC CDC website, and we'll be presenting more of our dynamic modeling next week as well.
I want to assure you, I'm not adding anything on the questioning of modeling to what Dr. Henry has said, just to say that we're expecting to present an update to the modeling we provided next Friday, probably Friday morning, so you can plan for that. As you know, BC was the first province to provide its modeling 2 weeks ago, and now others have followed, and we're going to update that modeling so people can see both how we're doing and what our expectations are on next Friday.
Vaughn Palmer, go ahead.
Yeah, I wanted to ask a follow-up on that one because now that we have the national numbers projecting deaths, I assume that British Columbia was involved in producing the national modeling as well. Most other provinces have done that, and as I understand Dr. Tam's reason for doing that, it is to provide the public with a sense of how things could play out if we exercise and follow through on stronger controls, and what could happen if we sort of slacken our guard. Can you explain why that doesn't seem like, that doesn't strike you as something that might be helpful out here, or whether or not you might change and incorporate the cumulative deaths the next time you do modeling here?
Yeah, so those are not projected deaths. This is the challenge. Those are models, so they're a range of possibilities of what could happen. It's not projecting what is happening, and what we are focusing on is the dynamic modeling that we have that shows us what is happening based on our data. And actually, death data is not something that is easily projected into a model, because scenarios can be very different. If you look at ours, for example, where we have a lot of long-term care home outbreaks, we have a high proportion of deaths in those outbreaks. That doesn't reflect the general transmission of this virus in our community. So I just don't understand. I don't believe that projections or estimations that are based on models are particularly helpful. What we are looking at is what we are dealing with. And what we've told you and what we will present again and continue to share the details of is exactly what we're tracking and how we're moving, what we're seeing on a day-to-day basis, and what the possibilities are compared to what we've seen in other places in the world. And it's not that different from what they've presented. I just, that's the modeling that we're using. We're being open and transparent with it, and we can see that the things that people are doing here in BC are making a difference, and that's the important thing.
Keith Baldry, Global News, go ahead.
Hi, Dr. Henry. Wonder if you could expand. You mentioned you've got some data that suggests people are indeed changing their behavior and following your recommendations. Just if you've got some examples of that, and also, Minister Dix, if you could explain further the $10 million. Is that are we about to see someone, instead of working at 3 different facilities, they're going to put 8-hour shifts in one facility, 40 hours a week, and that's how that money is sort of accounted for?
Yeah, and so in terms of the behavioral data, we'll present some of that next week, but some of it came out publicly on Google, for example, where they showed using anonymized big data of cell phone use or cell phone tracking. They could tell how much people were going to things like restaurants and bars, and how much that has decreased. The social interactions have decreased in different parts of the country and around the world, so part of it's based on that.
So that's an estimate of cost, and we wanted to present that today to give you a sense of what's involved. Different people working under different collective agreements in different care homes. What we want to do is to ensure that workers don't lose out. In other words, that they're lifted during the period of the order to this higher level, and that we would, of course, support that as well. And so there are differing wages, so people who are earning a different amount in 2 different care homes don't have to choose based on the amount they're earning, but can be chosen and assigned and worked the same amount, earn essentially the same amount regardless of the decision they make. So that's the reason why there's extra costs. It's in some cases salary increases, in some cases it'll be increasing in hours, but it's principally addressing salary differentials.
Next question comes from Dirk Meisner, Canadian Press.
Hi, Dr. Henry. I think you said 1 of the 21 long-term care homes now has no longer has COVID-19. I'm wondering how you go about declaring that, or finding that, or declaring that, and also, does that mean that people who have family members in there can go and visit a place once it's cleared?
So how we do that, we have an outbreak protocol that we use in long-term care. So it has to do with having no new cases for 2 incubation periods. So we've actually had 4 long-term care outbreaks that have been declared over because there have been no additional cases in those care homes. So that's a routine protocol that we use for outbreaks every year. in long-term care. In terms of the visiting policies, the sad thing, no, we are restricting visiting in all long-term care homes in BC right now, and that is because we know that non-essential visit, and I shouldn't call it non-essential because we know how important it is for our family members in long-term care to receive visits from family and from friends and from supporters, but we know that's right now a risk when we have COVID-19 in the community. So all visits are restricted in all long-term care homes right now in across the province because of the pandemic.
Next question is from Farhan Mohammed, Daily Hive.
Good afternoon. With the orders against non-essential travel heading into the long weekend and also looking to the future, are there plans in place for any sort of increased enforcement, whether through police roadside checkpoints or things like that, that are really going to prevent people from leaving town or heading to other neighborhoods outside of their immediate communities?
No, we have not taken that approach in British Columbia, and we don't intend to. And in most cases in Canada, we're not using an enforcement approach. It's much more about supporting people to do the right thing. Telling them what the right thing is, making sure they have the means to do the right thing. And as we have seen repeatedly, people do follow our advice around that. And so I expect that people will be taking that advice as well this weekend. And there will, of course, be the regular policing and public safety people doing their thing. So making sure that that all of the other important measures are in place in our communities around long weekends. But we do not have specific enforcement around people traveling.
Next, we have Tyler Olson, Abbotsford News.
Hi, Dr. Henry. I've heard significant numbers of construction workers who continue to carpool over longer distances to work site. I think in some cases the employers object, but they don't seem to have the ability to curtail this. What can be done to deter such carpooling or enforcement of the social distancing orders on roads?
Yeah, good question. You know, I don't believe we need to go out there and ensure that every car or every person walking next to each other is their part of the same household or part of the same family. It is, again, one of those things where we trust people to do the right thing. And we know that the vast majority of people do that because we all have a part in this, and it is our own families and our own communities that are going to suffer if we bring it into our community. So we have to take reasonable measures. We have to make sure that people have the means to do what we've asked them to do. We've put in those restrictions. If there are concerns in workplaces, WorkSafe BC has been working with many of them to ensure that the right precautions are in place, and we continue to need to do that.
Next question is Richard Sussman, Global News.
To Dr. Henry or Minister Dix, we're working on a story tonight about being able to get the N95 respiratory masks, and that one of our reporters was able to get them within 72 hours locally. And the question is, why has the province not gone to all the local sources in the province to get the masks before going elsewhere to get them? Why can people still order these N95 masks?
So N95s are what we call respirators. They are a specific type of filtering face piece. So it filters 95% of particles above 5 microns. And so they are, there are a number of them available. There are many different types. And the medical variety that we need has to be fluid resistant and a few other criteria. So there are many types of N95 particulate respirators that you can buy in hardware stores, for example, that may not meet the criteria that we need in healthcare. So we are sourcing in large numbers from various parts of the world because we know that they meet the standards that we need in the healthcare sector. If there's, I know there's still small amounts available of different types of respirators that may not be appropriate for healthcare, to be honest. So
I just took a look. I mean, I think what Dr. Henry said is that not all PPE is created equal, and Beyond certification, respiratory protection requires fit testing to ensure proper protection. And the model that I think the journalist used, and I may have the wrong journalist, Richard, but and that they're demonstrating doesn't meet the minimum fit test requirements. The masks that, in this case, it appears are large and with no metal nose piece to form the upper nose, no ability to fit our staff or achieve a successful fit test. During SARS, in fact, a large purchase of that particular brand was made, and even when we ran low on N95s, we couldn't deploy them. So I think what's key to remember is that it's not about quantity and speed of delivery, it's about quality and safety, and that is what we're doing. And I can tell you, at the federal level, at the provincial level, enormous numbers of contributors are working on this question of ensuring that healthcare workers have access to the protective equipment they need. And we need protective equipment in the millions, not in the tens, and we need all that protective equipment to meet the safety tests of and the protection tests that we require. And so everything we're bringing in is being tested now, and that's why it's not being brought in, arrive, and deploy. It's being brought in, it's being tested and deployed because it's safety first.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question today comes from Dominique Lévesque, CBC Radio-Canada.
Merci. Bonjour en français pour le ministre Dix.
Oui.
Oui. Pouvez-vous expliquer en français ce qui est nouveau pour les travailleurs de la santé dans les centres de soins?
Effectivement, nous savons que les résidences des foyers de soins de longue durée ainsi que ceux dans les établissements de l'aide à la vie autonome sont très vulnérables. On l'a vu dans les résultats, dans les statistiques, dans les décès qu'on annonce ici, surtout, y compris aujourd'hui. L'une des choses les plus importantes, c'est que nous puissions faire pour les protéger et ceux qui en prennent soin, et de permettre aux travailleurs de fournir des services à un seul endroit, ce qui réduit le risque de transmission entre les installations en utilisant les ordonnances en vertu des lois sur les programmes de santé publique et d'urgence. Nous avons développé une nouvelle convention collective qui garantit que tous les travailleurs, dans les autorités sanitaires, les organisations à but non lucratif et privées, reçoivent un salaire équitable et une stabilité d'horaire afin qu'ils puissent travailler sur un seul site sans difficulté financière ni interruption des soins aux patients. C'est ça la réponse. Merci beaucoup. Thank you very much.
Thank you.
Dr. Henry, we'll see you on Saturday.
Have a great day off.